In that moment, doctors stop being professionals and become the only hope which is left.
Когда начинается война, первое, что разрушается, это не только одежда.
Now imagine this. There is no proper hospital, no sterile environment, no advanced equipment, just a tent or a damaged room. This is where the field hospitals operate. Doctors perform emergency surgeries within the minutes of injury, not just the perfect surgeries but the life-saving ones. Their goal is very simple, to stop the bleeding, stabilize the patient and keep the patient alive, and they do this for 24/7. Sometimes even under the sound of a gunfire. This is medicine at its rawest form.
А теперь представьте, нет нормальной больницы, нет...
But here is something powerful. War doesn't just destroy, it forces innovation. A simple tourniquet can stop someone from bleeding to death within minutes. Special dressings, hemostatic agents can control severe wounds quickly. Portable ultrasound machines allow the doctors to see inside the body right on the battlefield. And through telemedicine, a doctor in war zone can consult a specialist thousands of kilometers away. In this movement, technology becomes a lifeline.
Но есть нечто удивительное. Война не только разрушает.
But not all the wounds bleed. Some stay hidden. A child who stops speaking, a soldier who cannot sleep, a mother who has lost everything, these are psychological wounds. Doctors today are trained not just to treat the injuries, but to manage trauma, stress and grief. Because surviving war is not just about staying alive. It's about being able to live again. The story doesn't end. For many patients, it's just the beginning. Learning to walk again with prosthetics, recovering from the nerve damage, living with scars, both physical and emotional. Rehabilitation takes months, sometimes even years. And doctors walk that entire journey with their patients.
Путь вместе со своими пациентами.
Now comes the hardest part. War forces doctors to make impossible choices, treating enemies and allies equally, maintaining neutrality, deciding who gets the treatment first. When there are not enough resources for everyone, and sometimes choosing between their own safety. And staying with the patient, there is no right answer here, only courage and humanity. Let me share something real. One doctor said, "You don't think about fear when someone is bleeding. You just move." Another one said, "We could have run, but the patient needed us more than we needed the safety." Organizations like Medicine Sans Frontiers carry the spirit across the world. These are not superheroes, these are just the ordinary people making extraordinary choices.
Позвольте поделиться чем-то реальным.
So when we think of war, let's not only remember destruction, let's remember the hands that are trying to heal us. Doctors who continue working when hospitals collapse, who choose humanity even in chaos, because in every war zone, while everything is breaking apart, there is always someone trying to save the life. And maybe that is the most powerful form of courage. Thank you.
Поэтому, когда мы думаем о войне, давайте помнить не только... Спасибо.